Jonathan fleur again from the Cebu Orthopaedic Institute. So today we are going to talk a little bit about the hip problems that we see today, and this is about mainly osteoporosis and osteoarthritis. So if you are interested in these two topics, stay with me for a while, and we'll try to give you as much value as you can during the time that you are listening. And for all your bone and joint needs, come see us at the Cebu Orthopaedic Institute. You can visit us at 4th floor Robinson Cybergate, Cebu City, or online at SiriusMD.com. So let's go. Good afternoon, good morning, good noon, good evening, wherever you are. This is Dr. Jonathan fleur from the Cebu Orthopaedic Institute. Today we are going to talk about hip problems in the elderly. So a little bit about myself that you don't really need to know. Let's skip this, let's skip that. I have nothing to disclose on this topic. So osteoarthritis is actually a wear and tear thing. So just like a car, kanang mga auto na mo hinahinay kahilis ang ligid, that is what osteoarthritis is about. It's the most common type of arthritis, and it's mainly a wear and tear. And you can have this, which is your cartilage and bone, and in time maghinay-hinay ug kahilis ang cartilage. The bone is still there, but the cartilage hinay-hinay kahilis, just like kadung giingon ako na car or auto, it slowly deteriorates. So I want to be clear because kaning arthritis, there are really many types of arthritis. So there are so many types of arthritis, like arthritis from food, arthritis from infection. There are arthritis from different causes. And osteoarthritis lang, it can be related to genetics or family history, but also it can be related to some injuries. There can be a primary or a secondary type of osteoarthritis, which means primary, wala gi cause, or secondary, maybe from trauma, maybe from past trauma, past infections, or some past surgery that can also cause arthritis. So as these degenerative arthritis worsens, you will notice na wala na ang cartilage. Mahilis ang cartilage, and when we have bone on bone, you can imagine kanang murag auto, gadagan sa kalsada, the car, without a wheel, running in the road. Sounds very painful, no? Sakit kaayo na murag na auto. Imagine nimo na naay auto, nagtagan sa kalsada, walay guma ang ligid. That can be what a patient is having with severe osteoarthritis of the hip or of the knee. Pwede ni sa tuhod, pwede ni sa other joints sa lawas, but it mainly comes in the weight-bearing joints, like the knee and hip, although pwede sa knee and other parts of the body. Now, this is actually the hip, and I'm going to skip this because I want to show you certain signs and symptoms. So if nakanotice ka na nagtakiang na si nanay or si tatay, and then kalit lang ni siya or hinay-hinay, nagkalisod ang ilang paglakaw, magtakiang sila, this can be a sign of many things. Arthritis is one of those things. That is why if naamoy oras and you may think that nag-worsen siya, come and see us at the Cebu Orthopaedic Institute so that we can check kung unsa gyud nahitabo. Most of these patients, pwede ra na nothing serious. We just need to check and examine before we get any x-rays. So examino na mo ang pasyente before any x-rays, tanaw na mo kung nabay na usab sa ilang mga bukog. This is showing you na pwede na ay limblet discrepancy, so mas taas ang usa ka tiil compared sa pikas, and that can happen from time or from injury, or even it can be natural na dugay na ni na kaning pagkabata pa ubog gyud. That can be also a sign of osteoarthritis. It can be many things. There can be patients na dili na malihok kayo ang joints, such as a flexion contracture, kay nigahi na ang muscles. That can be a sign of arthritis, as well as some other things as well. So that's why we really do need to, number one, examine our patients, talk to them, and get an x-ray probably in these cases to be able to get a correct diagnosis para makibaw gitawon sa problem. Because I've been talking a little bit about x-rays, this is an x-ray of the hips, of the pelvis, which is standing Klaro kayo na very round and nice ang joint. You also note that there is a joint space in between the ball and the socket. And here, you can see na wala na space. So there's no more space, and that is already bone on bone. That can be severe osteoarthritis already on the left, and avascular necrosis and OA on the right. So this is the AVN or osteonecrosis with osteoarthritis happening. That's the secondary type. So tungod na ay problem ang head, it became arthritic. It's painful compared to the normal. This is osteoarthritis also on the left, but this time walay osteonecrosis. So this can be a primary osteoarthritis. So in osteoarthritis, there's narrowing of the joint space. What na space? There's bone on bone. You have spur formation or kanang mga hait-hait. So there are pointy things that we see on the X-ray and the deformed na bones. That's a ball and socket problem, and because it is a ball and socket problem, it can be treated, number one, with weight loss and exercise. We don't really try medications or surgery right away. We try to treat our patients, number one, with weight loss and exercise. We want to educate you. We want to give you the medicines and sometimes a certain maintenance, like with paracetamol, and really injections and supplements before we give the surgery, which is actually a joint replacement. Okay, so this is something that we also do for hip fractures, but let's talk about the other hip problem, which is hip fractures. This is a survey in Asia, and this is a survey showing na nagkadaghan gyud ang osteoporosis. So our bones, our bone density as we grow old because of less exercise or less activity, less muscle mass, and even less hormones, we can have osteoporosis and we can have what is called sarcopenia, kanang magkagamay ang muscle density. And it can be because of menopause that testosterone levels grow smaller. And this is a graph showing the projection of people aged over 60 in the Philippines at 2050. So nakadaghan gyud ang mga elderly nato. They call it the silver-haired tsunami kay nakadaghan ang mga silver-haired people. And with this will come the high probability of more fractures occurring. So we don't want to have any fractures in the future, and we can prevent this even now by a good diet, good exercise, taking care of our eyesight, and we can hopefully lessen this projection in time. But with increasing aging population, I want to talk about hip fractures because it is one of the most expensive to treat. Ma-aksidente gani or mabalian og bukog mahal gid kay na, and mortality kanang dili magpa-opera for a hip fractures because this is actually considered an emergency in different parts of the world. Diri lang sa Pilipinas na agiun pa ang pasyente og hilot og mag self-medicate pa, and then maybe after a few weeks diha pa siya mo show up sa clinic or sa hospital. And I want to say that there have been studies here in our country that mortality rate is 50% at 1 year. So because kaning mga pasyente nato dili na sila makalihok, magkaluya sila, they can have complications, kanang komplikasyon sama ng pulmonya, ubo-ubo, di sila kalibang mag-pressure sore kay magsigil lang o higda, so masamad ang libot, masamad ang likod, daghan pwede mahitabuan nila. So mobility is an important factor for survival. Ganahan ta na makalihok niyang atong mga pasyente para dili magkaluya. And this is an average estimate in the Philippines. Of course, makakita gid ka na ay possibility na nabali ang bukog kay mumubo ang kanang tiil o nagtuyok siya. So shortened and externally rotated ang ato makit-an bisag sa emergency room pa lang makaklaro na miani. X-rays, we will also confirm this. So these are X-rays of a hip fracture, and this is treated in the Philippines just 50% surgically. Most of the countries, especially first world countries, will treat this right away within 3 days kay emergency like any. There are types of surgeries na we repair using screws or plates, but we have to also know that not all surgeries for this, especially fixation surgeries, are successful. Bone does not always heal, and internal fixation, kanang plates and screws, can have complications, which is why a lot of the surgeons will avoid plates and screws and go for a hip replacement and treating the osteoporosis. So replacing the bone, kay kabuk naman, that is a way to deal with the osteoporosis and the hip fracture at the same time. But remember, we also need to treat the osteoporosis by medication, proper diet, and exercise before we go into total hip or partial hip replacement. Because this osteoporosis or osteopenia can be treated with diet, exercise, and medications so that we can prevent hip fractures from happening to ourselves in the future or our loved ones. So thank you so much. Do visit us at the Cebu Orthopaedic Institute for your bone and joint and musculoskeletal pains and needs. We are located at Cebu at the Robinsons Cybergate, 4th floor, room 401. And that's the 4th floor of the Robinson Cybergate. You can contact us through Facebook. You can contact us also on the landline 239-2211 and schedule a face-to-face consult or an online consultation with us at SiriusMD.com, and you can choose from our many specialists in bone and joint. Thank you so much. Bye-bye. This is Jonathan for Luis, and